Well, good afternoon, and thanks for coming to the panel discussion of the second day of the Oregon Housing Conference. We have some of our session presenters with us today who will spend some time here answering questions from the chat. I'll be keeping an eye on that, answering questions from each other, discussing the sessions, the conference as we've seen it, and then just answering I'll be asking some clarifying questions of each member. So hope this is interesting. Keep it more interesting if you do add your questions into the chat. So let's just start, and everyone reintroduce yourself briefly, and what you came to the session, the conference to speak about. Dr. Lena, why don't you start us off?
Hi, I'm Lena Miller, and I am at the conference to talk about utilizing formerly incarcerated populations to work specifically with in unhoused shelters, interim shelter, and other services.
Thanks. And Simone Rede, tell us about you.
I'm Simone Rede. I'm the city auditor of Portland. And I was speaking with my counterpart, Jennifer McGuirk, who is the Multnomah County auditor. We talked about our audits of the Joint Office of Homeless Services and the ways that our offices are coordinating to conserve resources.
Thanks. And Jose, you have the most amazing backdrop.
Oh, thank you. That's our beautiful city.
Jose. Oh, Jose, we can't hear you.
Can you hear me now?
There you go.
Yeah, my name is Jose Garcia. I am the executive director for the Juntos program, and I spoke about barriers to housing people in recovery, and with a focus on the Latino community or Latinx community.
Thanks, Jose. Thanks for coming. Auditor Jennifer, introduce yourself.
Hi, I'm Jennifer McGuirk. I'm the Multnomah County auditor. I use she, her pronouns. And as Auditor Rede already said, we talked with each other about how we're auditing the Joint Office of Homeless Services and also how you can use audit results to support changes you would like to see in government.
That would be great. It would be helpful to our audience if you could both put your websites in our chat so people can visit your sites and see more about what our auditors do, how they help keep government accountable. Jimmy Jones, you just finished. You were the wrap-up session today. Please introduce yourself again.
Sure. Good afternoon, everybody. My name is Jimmy Jones. I'm the Executive Director of Community Action here in Salem, Vice President of our statewide association, and I do a lot of work on the housing and homeless issue across the state. I was here today to talk a little bit about engagement with the public and some of the barriers that we're having toward moving the general population to support this work on a much more broader basis, and some of the barriers, frankly, that we have around convincing legislators and the general public and our larger community of doing this work. Thank you.
Well, I'll start with you, Jimmy, that one of the questions in the chat from our favorite lawyer, Bob Jundep, is, so what's it going to take to reduce homelessness by, say, 50% in Oregon?
Yeah,
Oregon. What's the time frame?
Yeah, 20 to 30 years to get to a point where almost nearly everybody is housed. But I think, within 10 to 15 years, we can cut the total population in half fairly predictably. But it's going to take an enormous investment, financial investment from the state. We're going to have to treat this issue seriously, which I don't think we've been doing. It's going to take an investment to make sure that we have a continuum of services that are reflective of what the needs are among the homeless population. And so that means additional shelter, especially permanent supportive housing options, adequate peer support, adequate case management, adequate supportive services. And we're really going to have to invest in those things, including supply side answers as well, for the next decade to see any real progress.
Our auditors, do you have any estimation of this is possible to reduce the homelessness by 50%, just considering what we're doing with the joint office?
I think as auditors, we're very hesitant to give a timeline for when an issue like this can be solved. I appreciated what Jimmy Jones just said, that, it's going to take years and a lot of investments and really a lot of work to develop the kinds of systems that he was talking about. I don't know. Do you want to add anything, Auditor Ready?
I would love to. I think I could speak more generally about kind of the framework or governance that we like to see as auditors. The, signs of effective governance would mean having really clear indicators of performance so that we can make sure that services and spending's aligned. So that's kind of the auditor's response to whether a goal could be met, is having the clear goal to begin with and then managing towards it.
Before we go much further, I want to introduce or have Dr. Jessica Gregg introduce herself.
Hi, I'm Jessica Gregg. I'm the Chief Medical Officer at Fora Health.
Thanks, Jessica. Thanks for joining us. Now, look, Jose and Dr. Lena, you have the skills of reaching those very difficult to reach populations within the homeless community. What's your say on the timeline for solving this problem?
Well, I mean, I can speak on this. I think I don't know. I mean, to tell you the truth, it's very intertwined, the different things that are going on with the houseless communities. I think, because I think we all have to work together. Like, we have to create systemic change as to all of the services that are being provided, around culture specific services, mental health, addictions. We have different, aside from culture specific services, we also have different age groups. So we have, older populations living on the street, and those are, populations that also need a much different type of support. So for me, it's hard to say, like, we're gonna get this done in so much time, unless we all come together and kind of come up with a plan. And I think what's happening right now is that we're not all communicating, right? All the different systems are trying to fix one problem here and there, and we're not great at it because we're not working together. But if we all come together and come up with a really good strategy where we're looking at the whole system, then maybe we can create a change. But I can't tell you how long this is going to take, because I think the first step is working together.
Yeah, I think that's right. It can be done. I mean, that's the good news. We know that. In San Francisco during shelter in place, the pandemic, the city was able to get a lot of federal funds and, put up the SIP hotels. That's really when Urban Alchemy exploded. We were able to staff the first 3 and the first Safe Sleep. And then, so the pit count that happened the following year, homelessness decreased by 15%. In Los Angeles and the Hollywood and Venice areas where we are, it decreased by 50%. I mean, no one is talking about those numbers. For some reason, it seems we enjoy talking about gloom and doom and how it's getting worse. But I think we really need to study, where it's getting better and what's happening. I think activating a workforce is important, because you have to be able to staff the shelters and do it well and do it quickly. Also to address the issues that you mentioned, addiction looks different than it did 5 years ago. It's just a fact, and we have to start creating our responses to really reflect the issues that we're seeing on the street. So for some, there's going to be sober living. For some, especially with the proliferation of fentanyl, I mean, we may need to be looking at, long-term living situations, for people who are probably not going to get clean anytime soon. And what are new models to doing that? So I think it's really about how quick can we garner resources and then stand things up? I mean, you can do it in 5 years if you want to spend the money on it, but it's just that as a society, we have to we have to make some decisions about it. And then I think there's also the issue of you have people in Portland and in Oregon, and then you have the more well-resourced cities. If they stand up some of the solutions, then a lot of times what we're seeing all over the country is that other towns and cities surrounding, kind of start sending people into the more resource cities. And so you always have an inflow, and that has to be part of our calculus as well. But, totally doable. It's just a matter of how much we as a society, a government, are willing to invest in doing it.
Anyone have a comment for Dr. Lena? Or a response to what she had to say?
Well, I would just say money, if money was the issue, we could have solved this problem a while back, because I see there's a lot of money sitting in places. And so there's, the counties are holding to a lot of money, like the city holds money, the state holds money. And so I think it's money. If we keep throwing, the money needs to definitely be spent, right? So there's no sense getting money out there and have an organization just hold the money and not doing anything. And also, again, I think there's an important piece about working together with those funds, because funds have been distributed to some organizations, but not everybody's actually doing the work. And so I think, how do we hold accountable so then those organizations accountable, so that we know that the work is being done, because we're funding programs that are supposed to be out there doing the work, but they're not going out there and doing the work. And so I think there's, like I said, there's a systemic change. We need to change the way we fund programs, the way we get the money out to service providers. And we have to work with different organizations, from the private sector to the local sectors, public sectors. We got to work with the community members, community leaders who have the trust and respect from community members, so that they can help us communicate, with what's going on on the streets, so that people can believe what we're trying to accomplish. Because we also need a buy-in from people living on the streets. We can't just come in and say, this is what we're going to do, and change everything for them. They need to be part of that process, right? What's going to work best for them? And I like the what Dr. Lena Miller said. Some people may need recovery housing. Some may need to be just housing because they're not ready for recovery. Some people need mental health housing. Some people need stabilization housing. So there's all different levels of housing that people are going to need. So we got to think about, like, that the scope has to be bigger, right? We need to look at what's out there, what the community, and we need to hear more from the voices of the community living on the streets, so that we can develop these programs based on what the need is. So that's all I want to say.
Yeah.
Thanks, Jose.
Can I just underscore one thing you said? I'll be very quick. And that is, I found that the key to all of this is that you've got to have a buffet. There's all kinds of people out there, just a family, single parent, people with mental illness, people who don't, people, you have everything. And you really, I think the key to it is having options, that really fit with the individual in their circumstances. And I think when you're able to provide options, and all of them are clean, safe, that kind of thing, but that fits with people's lifestyles, it is so much easier. Like, to go out into any encampment and say, look, what's your situation? We got 5 places. We got this, we got that, we got this. And then usually the process just goes super smooth. So I think we really have to be mindful that, there's different folks out there with different situations coming from every circumstance imaginable. And we really have to be creative about how we're going to be able to provide, shelter and housing for unhoused folks.
I think this conversation is right here is showing how much has changed in the last couple of years. Is that homeless services system and the addiction service system had been starved for money for the last 50 years. And the reason it didn't function, and a lot of the reasons it's so dysfunctional, is because it's just starved. And now we're talking about a buffet, and we're talking about a menu of options, and we're talking about different varieties of housing. And that's kind of amazing. So just putting that there, things are changing. Jimmy Jones, you have a comment.
Yeah, I just wanted to agree and echo what Jose and Lena said. It's very critical that those messages are well understood. I'd also add that we spend a lot of time talking about resources and hard infrastructure, shelter types, housing types. We don't spend as much time as we should talking about developing and paying our staff well in these industries across the country. We have just, talking about starvation, we have starved those positions out for a generation. And if we don't invest in, develop, provide professional training, capacity building, find a way to pay our staff at a better and decent living wages, so that they're not burnt out, so that they continue to grow and develop professionally, so that they can invest a career in this work. Then we're always having to start over again and again and again, and that has really set us back far more than anybody knows in the last decade.
Dr. Gregg, ask you the question in a different way. Is solving the problem the right outcome? It seems like homelessness is almost a natural consequence for a lot of addicts when they don't have their addiction treated, when they continue to use. They just run out of resources and become homeless. Is solving the problem the right way to think about this?
Yes. I think it is still, and I think that, a lot of I don't want to sugarcoat addiction. It's a nightmare for so many people, period. And a lot of people, if all of the systems of criminalization, all of the things that are sort of coming down on people with addictions, if they weren't so busy battling those as well as their addictions, I think a lot of people can function with addiction. Fentanyl has definitely changed things. It is hard to get through a day for my patients on fentanyl because it's so constant. Yeah, that's a hard question. I do think that trying to solve the problem of homelessness is still correct. I also think that some people will not be housed potentially because it's just not going to happen for them. They're not going to even be able to handle a low barrier housing. But I do think that that is going to be a small proportion if we can provide support to the rest.
And we're thinking about solving two things here: solving the individual's homelessness and solving homelessness for us, the people who are housed, the people who are taxpayers, the people who want some change down in Salem. And those are very different things.
They are very different things. Some of it is the housed person's distress, right? And the other is the very real suffering of the people on the street. Yeah, I think that's exactly right. And I think that we often, in my neighborhood, it's really easy to look at my neighbors in a tent city and say, you're the problem. Like, you're the problem. You're the crime. You're the reason I don't have X. You're the reason I can't do Y. It's methamphetamine and it's the person living on the street, because that's a lot simpler of an answer than we can't pay our behavioral health workers. We can't, we don't have a safe supply. We don't have syringe exchange. Like, we don't have all this other stuff. We don't have supported housing. It's a lot easier just to blame the person and the drug.
We have another success over the last couple of years is that we have captured the attention of our legislators. At least here in the city of Portland and in Multnomah County, this is front and center of the work of our elected officials almost every day. Does anyone want to speak about that transition of getting the attention of the political leadership and seeing how things are changed, maybe culturally and psychologically and practically in these legislative bodies?
I think you've had enormous change in the last 5 years, and that's been evidenced by the fact that we have a lot more resources coming into the system than ever before. I do think a lot of it is being driven not so much by the intrinsic concern about solving this on a level of human decency, but primarily about addressing the complaints and the concerns of the general public and their desire not to be inconvenienced by somebody else's poverty. And that's the thing that drives me the most insane about all this in a lot of ways, is that for too many people, the lives of people living outside somehow have less value than the inconvenience that they have to suffer from dealing with the consequences of unsheltered homelessness in particular. But whatever the reason and for whatever purpose, I do think we've seen a renewed conviction that something needs to be done, and that systems that have withered on the vine for a generation are now finally getting a little extra funds and a little few more resources and a little bit more attention to take this problem more seriously than it's been taken in the past. So that is encouraging, but it's also troubling sometimes as well, because if you watch the legal environment of homelessness around the state, you've seen attempts to criminalize unsheltered homelessness. You've seen attempts to, to drive populations from one place geography to another. And so we're going to have to be very careful as that level of attention increases and that concern increases, that harms to the people that we're trying to help aren't somehow a consequence of that new attention.
We heard from Chris Herring about how that criminalization is pretty active in San Francisco, that's really escalating as the city leaders are panicking. And some of these, more difficult to reach populations, they already have sort of a strike against them and are more easily criminalized. So people who don't speak English and people who may have been in the criminal justice system before, this is an additional barrier to getting stabilized and getting housing. Oh, good. We have one of the issues that has been brought up over and over in the chat today is the unnavigability of the service system. That for individuals who are working, forget if you're seeking services yourself, it's utterly unnavigable. But even people who are experienced, integrated, knowledgeable, educated, and working in a reasonably integrated agency, trying to find out what's going on 1 foot out of their own agency requires an extraordinary amount of time and effort. This seems to be sort of an injury we do to ourselves. Has Auditor McGuirk, you looked at this with your audit of the joint office. How can we speak more clearly about the navigation of the service system? What are the barriers to that?
Well, I think some of the barriers are it's really opaque. And so, for example, we've had people contact the county ombudsperson to say, hey, I'm trying to get services, trying to pay my rent. I've been having trouble getting it paid more than a month at a time. How can I do this more efficiently as an individual? And us really struggling, like who know a lot of the players, to connect that person with resources. I think we've seen, and I think the other panelists spoke about this earlier, just poor communication between providers. And it's hard to know who has availability, who has resources available, who's opening a waiting list for the first time in, a great period of time. I think improving that coordination and communication is something that I hope that the joint office steps up and does a better job of, and something that we recommended to them, just to be more of a convener to help build those relationships. I think we can also try to make the system easier. If you call 211 and you need help, 211 should actually have a way to know where they can connect somebody, how they can get them services, and who has availability. And right now that doesn't happen from my experience. So I think there's a lot of sort of basic, simple communication that should be going better. And, we typically make recommendations around improved communication, and we can't exactly tell you how to do it, because then we can't come back later on and audit it. We're being too much of a manager if we tell you exactly how. But I'm happy to, hear ideas from the joint office and others, and maybe make some suggestions or provide some examples to them on how to be doing a better job of facilitating that coordination.
Other comments about navigation? Jose?
So this is one of the things that Juntos does. One of the reasons why we do navigation is because of what you just said. That our systems are so complex, and even complex for us who are doing the navigation and connecting to service providers. I think that one of the biggest issues is that there's no oversight as to how to do business when it comes to services. Like everybody does things their own way, which makes it difficult because once you learn a system, right? Once you learn one system and then that system denies you for services, you got to switch to somebody else, and then you have to learn that whole system all over again, right? And then those systems have, if you don't speak the language or even know how to read, right? And we're not even talking about language. If you just don't know how to read and you have to sign these forms or fill out long applications, and then the trauma that goes into asking the same question to the provider, to the person seeking services, right? You're asking the same question over and over, and if you're asking for housing services, sometimes they'll tell you, or rent assistance, you have to apply for all these different places because you got to get on the wait list everywhere, right? And everybody's asking you the same thing. Everybody's asking you the same thing over and over. And that's traumatizing for that person, right? And then I think it's also degrading, like saying, like, I must be a bad person because first I got to be on these wait lists, and I just, every time I give people my story, I feel bad about what I'm doing, right? So the system needs to be we need to have more ways for us to do more of I wouldn't say audit, but like find a process or an oversight, right, of all of these programs so that they all kind of sound the same. Like, why do I have to do X for this organization and B for this organization, right? If they're going to offer the same service and they get the same funding from the same funding program, right? Why do they have to be different processes if the funding is still the same? So that needs to be more of an oversight, more working with the providers to ensure that they are opening those doors, and also that when it comes to like my community, we don't respond to email or digital media. We have to go out there and hit the ground, like on the streets, word of mouth. Yeah, we have to do that word of mouth. We have to go out there, and so sometimes we create these great programs, but people don't know how to access them, and they don't know that they're around. They don't know that they're there. Like, you could be right next to someone needing services, but they don't know that you're right there because we're not doing the outreach that's needed for the different types of communities that we're serving. And so yeah, we definitely need to fix that whole system. Again, it's a systemic change. We have to change the whole system so that we can work together and make it more accessible to our people that we want to serve.
Dr. Lena, I think this comes right to you, is that once you have people settled in a little house or a tent, or they found a place to park their car, what's next? The navigation requires a human being, Jose Garcia, to sit down with an individual and have a long discussion. There's no list. You can't give someone a phone number. That is not, 211 is a waste of time.
Yeah, I mean, I think the most important thing is to get stabilized. That is the most important thing. When you're living on the street, you're in that fight or flight mode. It's hard to think because you're in a reactive mode, and not really using that, frontal cortex to really have, planning and decision making and stuff. So I think the first thing is you get people in very stable, predictable environments, right? They're not going to be assaulted. They can sleep through the night. Their circadian rhythm starts to reset. See, these are a lot of things we don't think about, right? Being afraid of someone attacking you, having to move, all these things that kind of trigger and re-traumatize people. So once you get stable, then it's about, kind of developing community, whether it's, other folks who share the community with you, or if it's, case managers and things like that. When you start to develop community and kind of trust and that human bond that we all have to have in order to thrive, being mammals, most of us, then I think it kind of facilitates the process to sit down with somebody. And yeah, you have to have the human touch. And that's what it is throughout all of this. And I think, Jose, you said it over and over, the whole system has to change. My biggest pet peeve with the homeless system is that everywhere you go that serves poor and or powerless people, the services are just awful. You know, even if you look at the difference between going to DMV and going to AAA to renew your, registration, it just shows you the difference, and how people are treated. And that's at a very kind of generic level. But somehow, whenever things have to do with poor people, we don't know how to do things, or we can't communicate, or the systems aren't up to speed. And it's like, whenever something has to do with making money, AI, biotech, name whatever it is, all of a sudden people get super creative and get the best systems, and everyone's working together and collaborating. And I would say we know what to do. We know how to do outreach. There's people out there who know how to do outreach. We know how to get people, barring any serious mental illness or serious addiction, into stable housing. I mean, none of this is rocket science, right? It's just that the industry we're in doesn't really pay well. And there's the idea behind it that I think we got to crack wide open and say, this is the most exciting thing that's going on in human history right now outside of climate change. And we ought to have a bunch of people who are putting their brains in a brain trust and working on this and studying what is working around the country and putting these systems in place, because it's not that we don't know what to do. I think we're all clear what needs to happen, and there's been examples of it. It's streamlining and getting everybody up and running the way we need to be going to make it happen. So yes, we've had lots of success matching people to housing and getting that. I think we got 30 vouchers recently for rapid reentry, and we're moving people through. When they get stabilized, they're ready to go. And so, once again, it's not rocket science. We know how to do these things. It's just a matter of really improving the system. I'm not sure how we'll do that, but we do know how to do it.
Jimmy, you're running a navigation center down in Marion County. How are you making this jump from getting a person in and stabilized to out and back into the community?
Well, the navigation center is only around 4 months old at this point, so we're having a little bit of growing pains as to getting that fully deployed the way that we want. But we have integrated that with a whole host of other shelter options. Basically, we run wet shelters here in Salem. That's not a phrase that's very common in Oregon outside of the metro, but it has been very successful so far. So we have 75 beds there. Those beds are full. We have 2 Project Turnkey motels my agency operates. Those are 75 beds, 75 rooms each. So, these systems, low barrier systems, are working. They are very challenging in a whole host of ways, everything from business operations to having enough well-trained case management staff to do it well, to having housing options on the back end. And I think that's the biggest thing about the navigation centers. They are really meant to be train stations. We don't want to be warehousing people. We don't want to be bringing people into a navigation center and keeping them there for 18 months. We really want to keep people there 3 to 6 months and then move them into permanent housing as quickly as we possibly can. And we've had good success with that so far. Our turnkey motels have the highest placement rate of any project in the community because, we're getting folks in and working with them in a case management environment and getting them stabilized and moving on into permanent housing. I do think that these newer models, navigation centers and the turnkey motels, which are incredibly expensive to operate, stand a great deal of promise and hope for the future. But it's going to require state government in particular to sort of see these as a priority and to fully fund them and invest in them on a long-term basis to give us a fighting chance, to run these low barrier projects for high barrier populations.
Dr. Gregg, you're seeing people coming in and spending a little time in your agency, and where do they go afterwards?
Well, if it's really a little time, so they come into our withdrawal management and that's it. It's unbelievably hard to see them go anywhere except for back out on the street. So with 3 to 5 days of care coordination and case management, it's every single star has to align in order to get them into a place where they can be safe and be safe, period. And if it is actual housing and not a shelter, not something that is temporary, then if they're using something like fentanyl, it's very rare that they can stay without sort of jumping out of their skin, because that fentanyl withdrawal, even after we've stabilized them in withdrawal management, even after they're on Suboxone, even after the whole jam, they are still feeling really terrible for several weeks. And so it's quite heartbreaking. When the stars align, you get someone out, they have a sober living that they want, and then they just can't do it because the substance has really taken a toll on their bodies, and they need more time, and there is no stabilization available.
From just an administrative point of view, and as a person in long-term recovery, that is very frustrating to hear.
It's
that
unbelievable. Yeah.
The cart is before the horse, if there's a horse at all. So, Dr. Lena, could people come out of Dr. Gregg's Fora Health? They've just gone through a few days of withdrawal. They've just started some medication. They may be still having all kinds of physical illness and weird behaviors and want to run and hide. Do you have someplace safe for them to stay?
Well, of course. You know, our most recent shelter at the let me see. It is just it's absolutely beautiful.
This is Gideon Crossing, right?
Yeah, Peninsula
Gideon Circle.
Yes, and there's Reedway and the Clinton Triangle we just opened. But it's gorgeous, it's beautiful, and all that is by design, right? Really serene. We got people there 24/7. By the way, this is the reason why these places cost so much. No one ever talks about that, but they're 24/7 staffing. I mean, so we're kind of, when I say we, I mean all of us providers, we're running institutions that aren't really being acknowledged. You know, we're making sure that people are safe. We are looking after people. Sometimes we're doing wellness checks every 30 minutes. You know, we are providing mental health professionals there, you know, to work with folks. Sometimes a lot of heavy programming, you know, NA, AA, different kinds of things. So yeah, you can go and get stable. But I do think it raises a bigger question, you know, when we're looking at drugs that are the new kind of batch of drugs that are completely transforming people's physiology, not only fentanyl, but the P2P meth, that we don't know yet. You know, I haven't seen too many fentanyl people who have recovered from fentanyl. I'm not saying they don't exist, but I'm saying as a society, we may need to start looking at some other long-term models. And, you know, some places are not going to be temporary or pass through, you know. That just may be our reality. And I think we have to look at all options because our reality is changing every single day. And we are faced now with a totally different reality than we had 2 years ago, even. So we have to start looking at everything. But yes, people can definitely come, they can get stabilized and supported while they're getting clean.
When we chatted a couple of months ago, Dr. Lena, you told me that the city of Portland had bent over backwards to get you the resources you need to make these camps safe and livable. Talk a little bit about the cooperation you've had from the city and your introduction here in Portland.
Well, I think, you know, we had garnered a reputation because we were some of the first to do the SIP hotels in San Francisco and the Safe Sleep and some of the newer models, you know, tiny homes, container homes, and had really good success kind of turning places around or stabilizing places that I think sometimes other providers has been a little sticky. They've been kind of hard models to pull off, like the Safe Sleeps. And so, you know, people gain notice. They want to know what's working. And I think the thing that we put right up front is that we understand that yes, people need safe places. They need 3 hots and a cot, but really we have to deal with the trauma that people have coming in. Pretty much, you know, most people have had some kind of pretty serious trauma before they became unhoused on the streets. There's like 100% chance you're going to experience some pretty severe trauma, usually multiple traumas. And so you got everybody coming in that are, you know, kind of struggling with, you know, not only trauma, but all these other issues, and you have to account for that. And I think it's saying, if this was my child, if this was my aunt, if this was my parent, what would I expect to see? You know, what would I want to be there? And so starting from that place, you know, one, that it should be aesthetically beautiful and calming. You know, that the staff should be very welcoming, very warm, very kind. That there should be services every single day, you know, that people that speak towards people healing, whether it be art or yoga or, you know, that kind of thing. And I think once again, we know this, when you're wealthy, you know, folks send their children or loved ones to really expensive places, you know, $10,000 for a month rehab or whatever it is. And then it all makes sense. But when you're talking about unhoused folks living in public government spaces, it's like just the bare minimum should be enough. And so we come in and say, listen, we have to address these things. If we want people to move on to permanent housing, we have to have these features to, one, allow people to stabilize, and then two, allow people to heal so that they can go to permanent housing and be successful. And so I think people all over the country, but particularly in Portland, as much as the general public gets frustrated with the government officials they feel like should fix everything, I think we're all just human beings. We're trying to figure it out. And, you know, government officials really want to find something that works. And so if you say to people, all right, this works, let's try this model, or let's do this model here. And, you know, I think people they want to find something that is going to move us a little closer to the evolution of this field, so we won't be so stuck.
Auditor Rede, would you be able to speak a little bit about that culture change that's happening at the city as people are just confronting this issue on an everyday basis and thinking about it in their own personal life, how they're bringing that to their work?
I'm not sure if I could comment on that, but I do want to respond to Dr. Miller's remarks just about trying to find something that works. I think the data-driven approach, the evidence-based approach, is one that you know, auditors are always pushing for. And I think something that would be encouraging to see is scaling of models that we know work. So I think that kind of data, the eye towards data and outcomes, is really one that we want to see, so that our systems are working smarter and doing a better job of serving people.
Very good. Other comments?
I can talk a little bit about what I've observed and the change in the city of Portland and Multnomah County dynamic. You know, when the Joint Office of Homeless Services was created, it really was pretty much overseen by Multnomah County. And with the change in the chair this past year, I think we are starting to see more collaboration, coordination between the city and the county, which makes sense if it's a joint office. Auditor Rede's office and mine try to coordinate and collaborate when we're auditing that area. Since we're both doing it, we want to make sure we're using resources as wisely as we can between our offices. And so, you know, this year is the first time in recent memory that I have where we've seen the Portland mayor and others come and testify to the Multnomah County Board about you know, different kinds of programs and approaches, and where they've been having some joint meetings together. I think it really I think the more folks who are going to take ownership and concern, you know, focus on this issue and have a stake in it, the better. So I've been pleased to see that. my 2 cents.
It helps when your mayor is also the former county chair. He's sat in both chairs and seen it from both perspectives. He says that Portland doesn't do homelessness, but oh, he knows better than that. So
let me just add about really quick about the cost, because I know Dr. Miller talked about how it can be expensive, and we definitely got to treat people with dignity. But I used to work for Multnomah County, and we used to work with high utilizers of services, and high utilizers of service could be one person spending about $100,000 to $200,000 a year on services, and so. What could you do if you had $100,000 or not, Dr. Miller? I mean, you could probably run a whole center for what, 6 months, a year, right? That's just one person using all of these services, and we have high utilizers right now, and so I think we do have to think different when it comes to the funding, and really not think about costs, because the cost of one person overutilizing these services is costing what it would cost a program to run, a facility that's going to serve multiple people. So. I just wanted to say that.
There's a great article in the New Yorker years ago by Malcolm Gladwell about $1 Million Murray, a fella in Philadelphia who was costing the city of Philadelphia $1 million per year because he kept lighting fires. The fire department finally pulled together everybody who was attached to him and counted up how much it cost, and it was $1 million a year. And this was, 25 years ago. Not terribly uncommon.
We have to come to grips with this. And I think that people with money, when, everyone's got someone in their family, right? Either with addiction or mental illness. And when you have a little more means, it's, you can spend more, put them in a different kind of facility, get different kind of care. And there's an expectation that their loved ones get a certain kind of care and treatment that makes sense. But seems to be some kind of disconnect, because when people see people on the street, they tend to other them, right? And it's human nature. It's human nature. It's no judgment. This is what human beings do. But in reality, people come from every walk of life. And sometimes people who have more means are able to put their family members in institutions with better care and services, but sometimes they aren't, and people come onto the streets, and these are everybody's relatives. These are everybody's loved ones, and they're all kind of here, and the public is tasked with taking care of them, and we give them a name, homeless, and everyone is irritated. Everywhere we do a shelter, people come out with pitchforks and they're angry at us like we brought them, and it's like it's everywhere. Nobody wants a shelter there. Nobody wants unhoused people there. But it's everywhere. And at some point we have to, as a society, understand that this is real and it's not going anywhere. And it's a number of factors. And we got to come up with a better plan than, get your life together and get off of drugs and stop making a mess, because that's not real. But there are real things that we can do. And I think there are different kind of living situations and structures that we need to begin to consider, knowing what we know about who's on the street and how it keeps replenishing itself. It is economic for sure, but there are also other issues, and those other issues are, addiction issues and mental health issues, and all that is mixed up. And so I think those of us who are out on the street, interfacing with folks every single day, it's pretty heavy, because you have to be a therapist, you have to be, you have to be an EMT, you have all these different things you have to be, and it's not really valued by society at large. And so I think that's what makes it hard. And that's why every time there's a shelter, everyone is so upset, because, you could put 3 people in housing for a month with that, but they're not considering, no, you can't, because they need a higher level of care.
Dr. Lena, and let's we have just a few minutes left, but I'd really like to go into something that Dr. Lena talked about earlier, which is the force multiplier here. We've battled addiction and homelessness for years, and mental illness and homelessness for years, but there's something that's even more complicated. We don't understand. It takes much longer to resolve, which is trauma. And I'd just like to ask all the folks here who are doing direct care, what are you seeing as far as the trauma that's caused by this experience, and what are you seeing as some solutions for that?
Well, that's one of the most extraordinarily complex questions I think we could discuss this afternoon. And it's very easy to kind of get trapped into this presentist view and lens and sort of believe that things are worse now than they've ever been. Which, you know, if you grew up in the 60s or 70s, that doesn't feel true either. But I do have to say that something profound has changed since the pandemic. There's just been a new gateway for homelessness that has been opened because, especially on the West Coast, we have these extraordinary rental increases, even with rent control like we have in Oregon, that has placed families and individuals on the precipice of just, becoming homeless for the first time. Usually that's a move into a car, and then from a car into a camp or a shelter, and then certainly outside after that. And the traumas that people are experiencing feel to me, and I've met with thousands of homeless individuals over the course of my career, it feels to me that are more profound than they have been 5 or 10 years ago. That may be tied to the growth of the addiction crisis, the amount of violence that's taking place in the community. But what I struggle with every day is that we do not have adequate systems to deal with the level of trauma that we are experiencing on a daily basis. We don't have the mental health supports. We don't have trauma-informed practices. We don't have trauma-informed shelters, and we're struggling with, a kind of compliance-based mentality from funders all the time that while they parrot this issue of, we must have trauma-informed practice, they do not actually do very much to help us get there. So we are constantly fighting double sets of expectations in a time when it feels like the level of trauma outside has dramatically increased in the last 2 years in particular.
I just think that, as outreach workers or people on the street, I think Dr. Miller said this, we're asked to do a whole lot with not a lot of education, like especially like peers. We put peers in situations where they're not ready to be in certain situations, and we need people with with different skill sets, to go, if it's mental health we're dealing with, mental health therapists or mental health counselors or QMHAs who have more experience dealing with acuity, because it is different, it is different. And the traumas that people are facing are way more complex than that we had before. And like I said, we're like Dr. Miller explained it correctly. Like sometimes we're like the therapists, we're like the doctors when we're out there. We're trying to like fix all these problems because the issues and things that are going on in the community are a lot. And when you're there to give somebody a hand, I mean, it's a lot of stuff you're being asked to do, and this is how we also burn our staff, right? Our staff, because they're being asked to do so many different things, and then we don't pay them well because the wages are so low, and so it's complicated. It's very complicated in that perspective, and it's not just traumatizing for the people we're dealing with. It's traumatizing for the staff, because we're not talking about the trauma our staff deals with on a daily basis, the things that they see when they go out and do outreach, the things that they have to deal with. And really, they don't have space to be able to, like, take a day off and kind of deal with that trauma, or they don't have a space so they can, we'll kind of just be like, okay, man, you dealt with this, now let's go again, let's go at it again and help somebody else, right? So the trauma that our workforce is facing in compared to the trauma that's in the community, that's totally different,
Yeah, I'm glad you brought that up, because I think, it's the reality. And people ask us all the time, well, what kind of mental health services do you provide for your people? I'm like, same as the firefighters and the EMTs and the police provide. I mean, they can go to Kaiser, But people have this expectation that there's all these mental, and we talk in these places, well, we need mental health. And it's like, okay, so the world has just caught up to mental health. You know, in the last 10, 15 years, we've been talking about it. Before that, anyone who went to go see a shrink, and I'm a psychologist, that's what the doctor is for, you know, it was kind of taboo. And so now we're talking about it, and people are talking about trauma. And we're beginning to talk about things in a different way, like trauma-informed care, and saying a lot of times when people are expressing these behaviors, you know, even addiction or whatever it is, a lot of it is rooted in trauma that people just haven't been able to work through. And when you break down the physiology of trauma, it makes sense, right? Because again, people are operating in that middle brain, that amygdala, that reactionary state where they're just waiting for the world to break down at any minute. And it's hard to sometimes stay focused on what you need to do in relationships and all these things that create security for people. And so we have these conversations, you know, going on around homelessness that are not complete conversations. You know, a lot of times we do not talk about, I was surprised we're talking about addiction openly because people don't want to conflate homelessness and addiction, and I understand it, but it's out there and we have to deal with it. And there's not a lot of systems developed to deal with this. And it's big enough that we got to start focusing and paying attention, at least start talking about it. You know, what we pay workers, and what we expect out of them, all of these things. And we're now starting to understand that, you know, people are not, they're not addicted, or they're not living outside just because of bad decisions or any other way that feels comfortable for us to other people and make it okay, or at least get through the day seeing somebody suffering like that. But that most people are in these situations because of some kind of unresolved trauma that they haven't been able to get out. And really the key to getting people better is to be able to go, you know, and to address those issues and go there with people and help them heal that deeper wound before, you know, too much other trauma is loaded on top of them. But there is a national shortage of mental health professionals. There is. And so I don't know what the answer to that is. Maybe we start training people so they don't necessarily need degrees, and there's kind of community level folks. But I think the first thing we have to do is start having honest conversations and stop throwing around, you know, mental health as the panacea for everything, because I think the demand versus the supply is 10-1 at this point for mental health professionals. So I just think we need to have a real conversation that reflects what's happening instead of the same conversation we've been having in 1990.
Well, this has been a real conversation. Thank you, Dr. Lena. That's quite a wrapping up comment. If there's anything else that people would like to say as we close out for today. I'd like to thank you all for.
Thank you all for all of your work that you're doing. It's really critical, and I really value it and appreciate the trauma that you're all dealing with as you're trying to help other people. Everything you've said has given me a lot to learn about, and also things to think about. How could we audit this to really support these systemic changes we've all talked about? So I took a lot of notes to see what we can do to help move the needle.
Well, thanks, everyone. And thanks to the people who come and sat through 2 days of pretty difficult stuff to listen to. It's been a great conference. We'll do it again soon. Take care and pass the word along to your others.
Thank you.
Thanks.